Hi, everyone. My name is Elle, and I'm talking today about doula access and postpartum care for birthing individuals in Nebraska, specifically LB416, which is a legislative bill that was proposed recently. I'm going to talk really fast because I've been trying to get this to 5 minutes and it's not working out. So first, what is doula and postpartum care? So doulas are professional labor assistants who provide physical and emotional support to you and your partner or birthing individual and their partner during pregnancy. They provide physical comfort, breathing techniques. They provide emotional reassurance. They provide information about what's happening, both pre-birth, during labor, and postpartum. And they also facilitate a lot of communication with the birthing individual and the hospital staff, which is a truly essential function, because it's difficult for you to navigate that when an individual is in the process of giving birth. They also just provide guidance and support for loved ones and breastfeeding assistance, all kinds of postnatal care. So a 2013 Cochrane systemic review analyzed 22 studies of more than 15,000 women to identify benefits of continuous labor and support by doula. Another review of 41 birth practices in the American Journal of Obstetrics and Gynecology in 2008 concluded that doula support was among the most effective of all 41 birth practices that they reviewed. And this slide just shows you a handful of the percentages that were identified by those journal articles. Decreased use of pain relief, decreased incidence of C-section, increased spontaneous vaginal births, decreased use of Pitocin, decreased length of labor, decrease in negative childbirth experiences, R scores, increased breastfeeding and prenatal and postpartum doula care. So there are so many reported benefits of having doulas involved in the pregnancy and birthing process. Why is postpartum support so essential? So right now there is a lot of emphasis put on prenatal care. I think everyone would understand why it would be beneficial to have someone during labor and delivery, but there's almost no attention paid to maternal postpartum care. So 57% of all maternal deaths occur postpartum. Of those, 18% is 1 to 6 days postpartum, and 21% is 7 to 42 days postpartum. For most birthing individuals, they are not being checked in on unless they're taking themselves to the doctor. So having home visits, having a doula that will check in on them could potentially dramatically drive down those maternal mortality rates, postpartum maternal mortality rates. So what is LB416? LB416 was proposed by State Senator Kavanaugh, and it was meant to address this gap in both in postnatal care and in doula care in the state of Nebraska. Nebraska does not currently license doulas. It also does not cover doula care through Medicaid. So LB416 requires that the state set aside funds to reimburse individuals for doula care. It also requires that Medicaid cover postpartum care for 12 months rather than the 3 months that it currently covers it for. And it discourages the idea of setting up a licensing board for doula care because in so many instances, licensing is a barrier for people to get into the field. Licensing is expensive. It's a complicated administrative process, and there isn't a federal standard for licensure. So someone who may have taken a licensing class, if Nebraska decided that we're not going to go with that organization, we want you to have a license from another organization, then the expense and the time that they went to get that licensure would have been wasted. Oh, the other essential part of LB416 is that it requires all healthcare professionals to receive anti-bias training, which is essential because health disparities undeniably exist, and they definitely exist in birthing. This slide talks about a few of the statistics specific to Nebraska and Douglas County. On average, Nebraska is higher in almost every category in terms of infant mortality, in terms of maternal mortality, in terms of prematurity, and all of those rates vary based on race, income, and education. So last week, I was fortunate enough to go to a keynote address that was part of Maternal Health Month through IB Black Girl. Ashley Spivey, whose quote this is the founder and director of IB Black Girl. And I thought that what she was saying here is so relevant and speaks specifically to why LB416 is essential, as does this. The benefits of doulas cannot be overstated in Nebraska. LB416 is a really simple intervention and an efficient way to address some of these disparities with these maternal and child health statistics and rates. And it's a really easy yes. But for those who may still be on the fence, I also wanted to share that there are some serious cost savings to employing doula care for individuals. Research has shown that doula care can curb the cost by helping demedicalize childbirth. And they also have been proven to drive down all of those obstetric interventions, which are extremely costly for both hospitals and individuals. They've also even been shown to improve like childhood academic achievement by having in-home doula care postpartum. So there are a lot of different ways that just providing extra care for women and children during pregnancy, delivery, and postpartum can really drive down long-term costs and short-term costs in terms of hospitalizations. So finally, I just want to wrap up by saying very quickly that I think that infant mortality and maternal mortality rates are two hallmark indicators of the health of a society, and they are definitely indicators and very revealing of what women and children's status is within a society. That the United States has the second to last maternal mortality rate and infant mortality rate of all of our peer countries is shameful, and that Nebraska is ranked 19th nationally is shameful, and I believe that we can do better. And LB416 is just such a direct and effective piece of legislation that would immediately increase access to care for so many individuals. So if you are located in Nebraska, or even if you are not located in Nebraska, I really urge you to contact Nebraska state senators and ask them to vote yes on LB416 and look into what kind of doula access individuals have wherever it is that you live, because I think that this is a truly simple and effective way to show more care for birthing individuals.